Very much, and Mr. Kine, thank you for giving up your time for a few minutes. I wanted to ask Dr. Lambrew something, and this was a situation that happened about a year ago before I knew the full extent of the mortgage foreclosure crisis in my congressional district, which of course is the worst in the country. My husband's a nephrologist, and he sent one of his kidney patients who had passed away. He sent his wife to my office, and this was her story. She and her husband had been employed, owned a home. It was a typical middle-class existence. She worked at the university, got a good paycheck. He worked someplace else, got a good paycheck. He developed kidney disease. And throughout the course of his treatments, and as he slowly lost his battle with the kidney disease, he lost his job. His wife lost her job. They both lost their insurance and ultimately lost their home. And this woman lost her husband. She came to my office because she was in a state of panic, but she also was talking to me about how can this be in the United States of America? We did everything right. We were both college graduates. We had good paying jobs. We were living the American dream, and we lost everything because my husband was sick. And it wasn't that they were uninsured. They were insured. They lost that as well. She came to me asking for relief, and I had nothing to offer her. I mean, I could commiserate with her, and I was upset and angry and chagrined, but that didn't. None of my reactions helped this woman in the least. Nor would my reaction have helped the thousands and thousands of other people that find themselves in this position. What would you recommend that we can do to ensure that people don't go belly up, broke, and bankrupt and lose everything they have because of prolonged illness when they have done everything right?
I think that the answer is quite clear. We cannot simply continue to put patches on this system. I mean, we could try to create something akin to the unemployment insurance system for health insurance, and that may solve some of these problems. But that's one set of many different problems. Amongst the people with medical debt, 61% have health insurance. This is not just an uninsured problem. The problem is pervasive, and I'll just repeat the statistic I said earlier. 50% of people report some family member who is skipping a medicine, delaying care, not getting care because of healthcare costs. That is just endemic, and I think the only way to solve this is comprehensive reform. I will say this.
How do you see that comprehensive reform?
I think we have many good ideas on the table. I think we build on what works today, our public program system, our private employer-based system to fill in those gaps, create an alternative that gives people a choice of a public type option like Medicare or some other type of public program, or private insurance choices like you have as a federal employee. We think through some sort of sliding scale premium assistance to ensure that low-income people have the means as well as the access to buy health insurance. And then we seriously look at costs, because once we get people in the system, we have to begin to identify those tools to begin to address chronic illness, focus on prevention, squeeze out the inefficiencies in the system, because I am convinced that we need to simultaneously get people in, but then look at our long-run trend, because the system needs to be sustainable as well as fair and efficient in the short run. It's possible. We have bipartisan plans out there. The business community is behind it. I think we really do have the opportunity in this next Congress to address this crisis.
It seems to me the way we deliver health care services in this country is, you'll excuse the expression, bass-ackwards. We spend most of our health care dollars in the last 6 months of life, rather than putting it in the front-loading the system where we have research and development and try to prevent these diseases and early detection and prevention if we can. This requires an entire paradigm change. How do we shift these resources while we still care for those at the back end of life who to me, it seems if we can figure this out, we could ultimately save billions of taxpayers' dollars while we keep people healthier and living longer in this country. But how do we do that?
Well, you're asking somebody who spent a lot of time on this. I have several papers and a book chapter coming out this month about an idea called the Wellness Trust, which basically says we're wrong in thinking about prevention as an insurable event. That if you really want to keep people healthy, you need to invest now in something that won't accrue for years and maybe even only accrue to Medicare. We need to think of a different type of system and make prevention and wellness more like, you know, our public safety systems and our national security than an insurable event. So John Podesta and I wrote a paper a couple years ago about the Wellness Trust, where you carve prevention out of health insurance, consolidate our public health spending into a trust fund, and you use that trust fund independent of insurance to try to focus on proven prevention. And that's the key. We have to focus on what works, because there's a lot of services and vendors out there who sell things called wellness and prevention that are not effective, which is why the Congressional Budget Office usually doesn't give us savings on this. If we focus on what works, target it, make it ubiquitous, and directly pay for it through a mandatory trust fund, we think you could get at this long-run problem. But it is requiring it to be something different than what we have today, not insurance and not funded through our public health programs that are already overstressed trying to deal with biopreparedness and other different issues. Thank you.
Mr. Kind will.
Thank you, Mr. Chairman. And, you know, the hour's late. The panel's been great. The hearing's been very interesting. So let me just ask, and maybe Mr. Greenstein, we can start with you.